Alarms are being raised by Democrats in Congress over plans to cut Medicaid. They're considering billions of dollars in cuts to the program, threatening health care coverage for some of the 80 million low-income U.S. adults and children now enrolled in the safety net program. The majority party in Congress is looking to slash federal spending in order to pay for mass deportations, the border wall, the military, and to extend large tax breaks to the wealthy and corporations. Medicaid is one of the larger targets for cutting. This year, the program cost taxpayers $880 billion. This week, in an interview on Fox News, President Trump said he would not cut Medicaid.
Social Security won't be touched, other than if there's fraud or something, we're going to find it's going to be strengthened, but won't be touched. Medicare, Medicaid, none of that stuff is going to be touched.
Nothing.
You don't have to.
Well, our first guest is Alison Yager, the Executive Director of the Florida Health Justice Project. She works to expand health care for marginalized Floridians and to promote health equity. And Alison, welcome to Florida this week. Great to see you.
Thanks so much for having me.
The president said right there that Medicaid would not be touched. Is that your understanding of what's going on in Washington?
Well, at the moment, the proposed budget cuts do include major cuts to Medicaid. We are afraid that there could be as much as $880 billion taken away from the Medicaid program, which would be absolutely devastating to seniors in nursing homes, low-income children and parents, and people with disabilities across the state.
Let's talk about seniors in nursing homes. A lot of people at the end of their lives run out of money while they're in a nursing home, and they transfer over to get their nursing home care paid for by Medicaid. That's the way I understand it. Is that what happens?
Yeah, that's absolutely right. In fact, Medicaid covers the care of more than half of Floridians that reside in nursing homes. You know, really the program is essential for seniors. In Hillsborough County, 1 in 5 seniors are covered by Medicaid. And across the state, more than 700,000 seniors are receiving essential coverage through the Medicaid program. So really, this is a lifeline for our aging population in Florida.
Does it mean that some people who are now in nursing homes, if these cuts go through, they may not be able to afford the nursing home they're in?
Well, the challenge that we're facing right now is we really don't know the specifics of how these cuts would play out. The way the system functions right now is that Medicaid is a program where the costs are split between the state and the federal government. But if these cuts go through, the federal government is going to cap its share of payments, really leaving the state holding the bag for additional costs. And what that's going to mean is the state is going to have to make impossible choices about where to cut funds. So it could mean that people who are today eligible for Medicaid long-term care, once the cuts go through, will no longer be eligible. Or it could mean that there's a long waiting list to receive services. It could mean that care is cut off for some people if eligibility changes. It could also mean that reimbursement rates to providers change, and some facilities that accept Medicaid now might decide that reimbursement rates are too low and no longer participate in the program. So the specifics of how this plays out are still to be determined, but what we do know is it could have a crippling effect. It would have a crippling effect on our healthcare system.
And these cuts would also affect people who are low income, families and children who are now on Medicaid. How many families in Florida have to rely on Medicaid for their healthcare insurance?
Yeah, well, what we know is that there are over 2 million kids, which translates to about 40% of our state's children who are covered by Medicaid. So this is not a marginal program. This is a huge program that so many Florida families rely on to ensure that they can take their kids to the doctor for preventive care, for annual checkups, but also for kids that have ongoing medical conditions. This program is absolutely essential to keeping those kids alive, quite literally.
One of the ideas is to have those Medicaid recipients be required to do some work. Have you heard that proposal in Washington, and how would that play out here in Florida?
Yeah, so work requirements, if they came to pass, would account really for a small fraction of the savings. And that savings would really come from eligible people getting disenrolled from the program because of a whole new slew of red tape requirements, reporting requirements. But in fact, the vast majority of the cuts really would need to come from areas beyond those savings from disenrolled folks from work requirements. So really, we are still looking at drastic measures that would take healthcare away from these vulnerable populations that we've just been talking about: seniors in nursing homes, low-income kids, pregnant women, people with disabilities. So the work requirements are in some ways really just a small fraction of the damage that we're looking at.
Yeah, if there is a work requirement, as you pointed out, there's a lot of people who can't work. Children, people who are disabled, women who are pregnant. I mean, it really doesn't do much, I would gather, to create more efficiency or change the program.
That's absolutely right. And in fact, in other benefits where work requirements have been imposed, they're typically for able-bodied recipients. And exactly as you just said, virtually everyone in the Florida Medicaid program is unable to work because either they're a kid or they're a senior or they're disabled. And for the parents of low-income kids who are covered by this program, the fact is most of them are working. So it's sort of a misconception that the people who could work aren't. The folks who can work are typically working, but most of our covered individuals are unable to work.
Well, Alison Yager of the Florida Health Justice Project, thanks a lot for coming on Florida This Week.
Thank you so much for having me.